Good morning, dear. Today we are going to talk about wound dressing. I'm Dr. Hany Saad, Assistant Professor of Plastic and Reconstructive Surgery. This is a wound from the year 1490. It's a depiction of a dressing on a face from a painting. Can you see the wound on the face? It's not about the whole of the patient, it's the whole of the patient of any age. That's to say, before looking at the wound, we should always check the patient as a whole. Okay? We may use our eyes, your ears, your nose, your mouth to know and got to the optimal knowledge how to assess and know what's about this wound. Evaluating of an open wound, the first question that arises always, is it life-threatening wound? And question number two, is it an acute one, a fresh one, or is it a long-standing or a chronic one? The wounds we have got either low risk, high risk, or infected wounds. A low risk that's not assessed to be infected or had high risk of infection. The high risk that has been assessed as not being infected, but still it's at high risk of infection. And finally, the infected wound itself, where the vitalized tissues and involves preoperatively existing infection or a perforated viscera even. For the low risk, we should clean the wound, close the wound with sutures or tissue adhesives, adhesive strips, dress the wound and then follow up. Where at high risk, we do the same, but with dressing of the wound and not closing the wound, and starting antibiotic therapy, tetanus if needed, and then close the wound where there is no signs of infection. Usually stays for a couple of days before doing so, and then follow up. Finally, at the end, for the infected wound, we should clean the wound, dress the wound, start antibiotic therapy and tetanus if needed, close the wound as the high risk wounds, and then a follow-up. What's the aim of the dressing? There is a lot of points to be covered by dressing. It stops bleeding, it absorbs the exudate from the wound, it helps to promote wound healing, it prevents or eradicates microbial contamination. There is some dressing that does some debridement to the wound, and as usual, it decreases pain for sure, and it reduces the psychological stress on the patient. How to select your dressing? You always keep in mind that you should keep the bed moist and keep the surrounding tissues dry, and control the exudates without desiccating the bed of the wound itself. Dressing, we've got dry dressing, wet to dry dressing, and wet to wet dressing. There is a balance with the dry and the wet dressing. The too wet dressing, we should remove the moisture, absorption, sequestration, debridement, and treat infection. You should always keep a balance and maintain it in the middle, not too dry and not too wet. Sessions of the practical sessions this day, we have got dressing of a raw area and dressing of a suture line, as shown in the photos. Steps of dressing, we have got to do the following. First of all, to irrigate the wound only if required and use the clinical judgment, and then to clean it, then swab it, and then dress it. Here's the procedure. Before doing any dressing, you should read the patient, explain to the patient the full procedure, the expected pain, and again a consent from the patient for doing the dressing. Check the patient's comfort and always assure minimal exposure. Prepare the equipments needed. You should have scissors, a mosquito or an artery, a toothed or non-toothed, and then the fluids you will need. You should have gloves with you, either latex or sterilized gloves. You should have saline for the dressing and betadine solution. Vaseline gauze should be needed, especially on open wounds, and gauzes as well, and wrapping gauzes, and strips at the end to close the wound. You should wash your hands and put on your gloves. You should start to remove the old dressing, and very important step, you should examine the dressing and the wound. If it's hot, you have got purulent discharge, or in case the level of exudate, is there any swelling, any redness, change, any systemic high temperature, any change in the appearance of the wound, any normal granulation, or it's becoming dark and bleeding easily, this is an abnormal appearance of the tissue. And then finally decide if there is wound deterioration or not. You should start by hand sterilization and wearing the sterile gloves as shown. And then starting to swab the wound with a betadine solution with a gauze in one way and with saline next, and then start drying the wound. And then at the end, wound coverage, either with steri pads or with gauzes, and wrapping the wound. You should always report the time of your dressing, the condition of the wound, any changes or abnormalities you have found while doing this dressing. Summary again: gain a consent, prepare the area, prepare the equipment, prepare the patient, prepare yourself, minimal exposure of the wound, maintain the patient comfort and his dignity, clean the area and reusable equipment, document your procedure in patient's notes. For dressing, you have got two techniques, either touch technique, wearing sterile gloves, or non-touch technique, using instruments. Thank you.